So what is liposuction? What actually happens with the liposuction? Do you know what recovery entails after you've done your liposuction? To know more about liposuction, please watch this video. Thank you. Today, I want us to focus on all things liposuction. Liposuction is probably one of the commonest cosmetic procedures that plastic surgeons do. And it's basically a procedure where we get rid of the excess fat where it's located. So there are different areas where the liposuction may be done. And some of the common ones include the lower abdomen, just about here. Then you have the flanks as well, or on the sides here, the back. What else? The thighs, the arms. So I would say these are probably the commonest sites where liposuction is done. So once we, find out that you're the rightful candidate for it, you have excess fat in any of these parts of the body, then when we remove that fat, that procedure is called liposuction. Who is the rightful candidate? So what actually happens with the liposuction? So we find that you're the right candidate for the procedure. We've done certain tests on you, and you found that you are, you're fit to have the surgery. Of course, we'll take you to theater. I'm just going to focus on the upper abdomen. So we'll lie you down. You lie on the operation table. Let's say your arms will be stretched out wide like that. Your head here. Our focus will be, let's say, for example, will be here on the abdominal fat. So we'll inject a fluid. That fluid contains certain medicine. There's pain medication to help, of course, with the pain during your recovery. There's also a medicine which helps to constrict the blood vessels and reduce the amount of bleeding. So we put that solution into the areas where we're going to do the liposuction. Let's say, for example, the abdomen in this case. We give some time for that solution to, to do its thing, give it some time to kick in and do its work. And then, if this is of course your umbilicus, or your umbilicus there, we shall put certain holes, because with liposuction, we don't actually cut. We just create stab incisions. We call them stab incisions. We tend to put them in areas which are generally hidden. Not all times, but we generally put them in areas which are hidden. We then use special instruments called cannulas. They come in different sizes. We then place these cannulas through these holes, and then we do the liposuction. Usually, because it's, the cannula is attached to a machine that does the fat sucking, and there's also what you call the certain machines which vibrate, and that vibration helps to dislodge the fat, free the fat, and then the suction pulls the fat out of that particular area. Of course, you have to do this liposuction very consistently on all areas where it's done, because you don't have skin irregularities, which of course is a possible complication that can happen when you're doing your liposuction. So we do this consistently in all areas of the area where you're doing the liposuction, so it all comes out symmetrical at the end of the procedure. Once the liposuction is done, again, depending on which part, if we've done it on the abdomen, for example, we then fit you in what we call a compression garment. That compression garment is designed to press you so that the tissues get down to the, just remember you've done the liposuction. If that is the skin, the fat was here, and now just here is most likely going to be the muscle. So you've removed the fat. So now you want to get the skin closer to the muscle. Why? Because after you've done liposuction, move the fat, you've created a potential space. And in that potential space, fluid can form, and that is called a seroma. So we put in a compression garment to try and reduce that space, and that might help to also reduce the risk of that seroma forming. So we put in that compression garment, and then we take you to recovery. Sometimes, if the holes are too big, we might put a stitch or two to try and close the holes up. But generally speaking, we tend to leave the holes open so that the drainage can happen naturally in case the fluid does form, because it's quite common. And then, yeah, we take it to recovery, and the recovery journey starts after that. Thank you.